Good afternoon, everyone. Hi, and thanks for joining. My name is Erica Lycan. I'm Director of Corporate Partner Services here for CHIME Foundation. Really happy to have you on today's live webinar. We're really glad to have Damo Consulting as our host firm for the session. And I know they're excited to get to share with you. Before we get started, just a few brief logistics. The first of which is if you have any technical questions or audio issues, etc., please feel free to use the chat feature. You're welcome to chat me directly, and I'm glad to assist. I'll note too that there is a ability to use your little microphone icon at the bottom of the screen if you need to dial in with your computer or your phone, vice versa, if you're having audio trouble. I'll mention that this is a webinar, and so at the end of the session, we will have time for some question and answer. If you have questions that come up throughout the presentation, please feel free to use the Q&A box, and we'll make sure we note those, and when we get to the end, we'll be able to share those with the Damo team. So I'm really looking forward to it. You will earn CEUs towards your CHCIO for attending if you are CHCIO certified, so that's great. And again, we just appreciate your attendance on the call here today. This is being recorded, and we'll share that recording with the Damo team, and they can choose to send it out afterwards if they'd like. So with that being said, I'm going to go ahead and turn it on over to Paddy and Sara from the Damo team, and they will take it from there. Welcome, Paddy.
Thank you so much, Erica, and welcome everyone to this webinar. The title of this webinar is Digital Maturity Assessment and Technology Selection. We are going to talk a little bit first about some recent research that we have conducted with CHIME on digital priorities for the year, especially in a post-COVID era. And then we'll talk about the Digital Maturity Assessment Framework from Damo Consulting, where we use an online assessment tool and a maturity model framework to benchmark digital efforts and to accelerate transformation. And we'll talk a little bit about the digital health intelligence platform that helps health systems select technology partners and accelerate their transformation journeys. So just real quick, I'm going to cover a little bit of who we are before we jump into the content. We serve healthcare enterprises. We are exclusively focused on healthcare. Most of our work is with health systems. We also work with technology partners and technology solution providers who serve health systems and who are in the digital transformation space. So our work for health systems covers digital roadmaps, technology strategy, and partner selection. We deliver a lot of research and insights, and that helps us power some of the consulting work that we do as well. Importantly, we are not a technology solution provider, so we don't have a tool or a platform to sell. We're also not a technology implementation partner, so we are essentially an advisory firm. And the work that we do for technology vendors is primarily related to their growth strategy. They look to us for specifically advisory services related to the healthcare provider space. So that's a quick overview of who we are. And I'd like to start by introducing my co-presenter today. Sara Vaezy is Chief Digital Strategy Officer at Providence Health. Sara, welcome. And now the one on the left is me, and I am just going to go straight into the content. So every year we conduct a survey of CHIME members to understand digital priorities for CHIME members. And this year we just completed the research. We did the survey during the months of January and February, and we were able to get all of the responses and analyze them. And I'm pleased to share the analysis with you as a part of this webinar. But we are going to start first with a polling question. And you will see that come up on the screen in a moment. I'm going to read out the polling question to you. What is your organization's top digital priority? Is it online access to care for consumers, improved patient communications, expansion of remote care programs, or something else? So take a few seconds to go ahead and submit your responses, and we will look at the results momentarily.
Looks like we're getting some responses here, Paddy, which is great. I'll give people about 15 more seconds to respond. All right, wonderful. Looks like we have a pretty good percentage. So I'm gonna end the poll here and share results. Can you see those on your screen?
Excellent. Yes,
Great.
so we see it. So let me read this out real quick. 25% of the respondents say that it's online access to care, 20% improved patient communications, expansion of remote care, and something else. I would like to dive into that something else at some point, but Sara, what do you make of these responses?
I think, I actually think that they make a lot of sense. I am very curious about what's in the something else bucket. The online access to care for consumers doesn't surprise me at all because of the sort of what we've all kind of experienced over the last year with COVID, and the need to provide things like virtual triage and symptom checking and things like that. Um, each one of these merits so much additional discussion that I think we should just move forward. The remote care programs, too. The other one I'd be curious about is to what extent were those around before COVID versus now, and with a bit of acceleration in value-based care, but also just the need for things like home monitoring of COVID symptoms and things like that. So really interesting. I am very curious about the something else category.
Yeah. No surprises though, right,
No.
Sara? All right, excellent. All right, we're going to close this out and let's jump into the charts from the survey that we did earlier this quarter. So we asked a handful of questions in the survey, and we started with this one. What are the digital patient engagement initiatives your organization is currently focused on? And so these were the average scores for the responses, and you can see here the number one priority is real-time virtual consults. And of course, in virtual consults, we are including virtual visits as well as provider-to-provider consults in the definition of virtual consults. But regardless, it seems to be the number one priority. Appointment scheduling and reminders seems to be very high. Again, obviously, because I guess access to care is number one priority. Improved automated patient communications, that was there in the polling questions as well. And online self-service tools. Sara, you mentioned the symptom checkers and chatbots and so on. So we also have a couple of comments over on the side. Those are actually verbatim quotes from the survey responses. Huge focus on touchless registration. I guess that's a direct consequence of the COVID experience. And much focus on tools for patient engagement, portals, self-scheduling, communications, billing estimates, payment. It's a big focus on the financial side of healthcare. Sara, any comments?
I think these reflect a couple things. One is the notion of sort of distribution and distributed and decentralized care driving a lot of the sort of consumer-oriented capabilities. That's similar to what we've done at Providence, which is that, we've got a tech stack that's very much focused on delivering and enabling distributed care. We actually made an announcement earlier this week about a spin out that we just did focused on that, which is a company that does sort of demand aggregation, supply demand matching of care, which became very important for us during COVID. And it's across modalities, whether it be virtual or physical, as well as navigating patients to the right venue of care and the modality of care based on their unique needs. So, that's that's part of our consumer-oriented strategy. And a lot of these also similarly seem to be focused on that. I mean, not surprisingly, I think digital is a key enabler of growth, as well as sort of those customer experiences is being reflected increasingly. And it's, all of these things are kind of targeted at what I would say, in a way, our strategy, which is getting customers converted from an offline, disengaged, experience to an online engaged simply beyond, not just focused on clinical, but beyond clinical engagement, the other kinds of things, right? Whether it's the financial journey or things even more removed from that. So this is very interesting. And, I think it would also be an interesting discussion with respondents around like appointment scheduling. What types of appointments? Is it primary care? Is it specialty care? Like, how does it all fit into the broader business goals and the operating model of the system? So yeah, this all resonates. I think there's a lot more to unpack, and I know some of the future slides will do that. So I'll stop talking.
Yeah, let's go to the next one. In fact, I think we jump from priorities to actually how you're going to implement those priorities. Right? We talked about a number of what is commonly referred to as digital front doors, so whether it's payment, whether it is online self-scheduling, symptom triaging, and so on. So from a technology platform standpoint, we asked the question in our survey, how do you describe your digital platform strategy? And over half the respondents stated that the EHR platform is the primary platform for driving digital engagement as well, and followed by EHR is used for core functionalities, but we look selectively at best-in-class tools beyond the EHR. And then, we have a small percentage at the far right, looking primarily to non-EHR platforms. That's really out there in terms of a strategy. And then, there's a sizable number. They say they're still evolving the digital platform strategy. So, when I look at this, I go, okay, this sounds intuitively familiar to me, that more than half the respondents are still relying on EHR. But I'd love to hear your thoughts on this, Sara. What does this distribution tell you in terms of where health systems are, and how does it stack up against your own observations, both within Providence and outside?
So this doesn't surprise me at all, but I want to point out an interesting sort of cognitive dissonance, if you will. To the previous slide, most of the use cases are sort of consumer oriented, right? Whether they be focused on the transactional piece or the communication piece, they're generally consumer oriented.
Yep.
However, the EHR, which is primarily being used, is not a consumer platform. And so I think folks who are on the phone should kind of think about, is the platform that you're using as an enabler for this actually going to help you achieve your consumer-oriented or other-oriented goals? And even for things like remote patient monitoring, which I would say is not very consumer-oriented, one of our key learnings was that we stood up a COVID monitoring, remote patient monitoring program during COVID. And I've talked about this actually on a previous CHIME webinar, but it was very simple. I mean, it was fundamentally just text messaging, requesting patient entered data that we would then get. And it was not based in the EMR. Because even though it's not necessarily consumer oriented, meaning it's not focused on capturing new patients, it's not a patient acquisition tool, it's not a marketing tool by any means, it's very much focused on existing patients. Even that and the friction that was introduced via the EHR, requiring logins and things like that, limited its adoption. And so I think folks should really spend some time thinking about the goals that they have, the business goals and strategy that they have as it relates to their transformation from a digital perspective, and then marry that up with the platforms that they're using. The EHR is great for many things, but it's not a consumer oriented platform. And then also it would be really helpful for them to think through, for instance, it's very rigid in terms of the data liberation associated with it. And so to what extent what forms of data are you trying to get out, and what do you need to be able to do with that data, and then how do you actually effectively get it out? Like for us, it's a lot of transactional data and things like that. So this doesn't surprise me again, but it merits a lot more, I think, investigation on behalf of systems to marry up the technology strategy with the business goals, and use. Last thing I'll say, this is not a EMR bashing conversation necessarily, but use it for the things that it was intended for, and then find other ways to achieve things like a more consumer-oriented architecture with other technologies potentially.
Yeah, and in fact, the quotes on the right, I think, reflect the range of perceptions, if you will, on EHR platforms, ranging from, yes, we're going to use EHRs for everything, to, well, no, they're not really, evolving as quickly as we want them to, so we're going to go look outside. So
yep.
Let's go to the next one. What best describes the way your organization drives digital initiatives? We put this question in the survey because we feel that as much as the initiatives itself, as much as the focus on the initiatives, it's also how you're organized to drive the digital agenda that is going to make a big difference in whether you're going to be successful with it, whether you're going to create the kind of seamless experiences you're looking for, whether you're going to drive innovation and harness innovation and so on. So from an org model standpoint, our observation through our work is that there's a number of different organizational models, and this chart seems to suggest that the CIO is the de facto leader for the digital function as well. And this lines up pretty much with what we see in the market. Of course, we have some interesting other emerging models where we see that the digital function is an additional responsibility for a clinical leader. And on the far right, you have full-time chief digital officers that are responsible for digital initiatives across the enterprise. And of course, I am concerned by the fraction that say that they don't have a digital function. I think they really have some catching up to do in the market. But what are your comments on this, Sara?
So actually, I find it concerning that the don't have a digital function. Time is running out for that, for us to kind of get our act together, period. And so that one is concerning to me. The digital function as an additional responsibility for clinical or operational leaders is an interesting approach. But I think it's potentially challenging because what you're asking those folks to do is, one, both optimize their existing work and transform it at the same time. And it creates there are a lot of interdependencies, and I think it may be very difficult to achieve that. Now, the benefit of it is that we've seen that when you do marry clinical and operational with digital, magic happens if you can do it right. And so it's an interesting approach, but it's often very difficult to execute on. And I haven't seen it work as successfully as having a separate function that then partners very closely with the clinical and operational leaders. The CIO leading the function is an interesting one, but again, similar to a clinical or operational leader, a CIO is very different from a chief digital officer. A chief digital officer is responsible for that conversion from offline to online, and driving engagement, and that whole mentality around how you transform the front end of the organization from discovery through delivery to engagement. The CIO it's like asking someone to do that and asking him to do picks and shovels and build roads and like infrastructure and all the applications. And I think it's a different set of competencies and a different type of leader. So while I understand it, I think that it has the potential to essentially digital then just becomes sort of another infrastructure play, which for us we've learned is not aligned with where we're trying to go, which is that it needs to be less infrastructure, more about operating system and transformation.
Right. So let's go on to the next one. what are the focus areas for the IT function? We talked about the CIO, excuse me. Obviously, the infrastructure is a very important component of digital because having a robust infrastructure is what is going to enable you to deliver the kind of experiences you're looking for. So when we look at their priorities, we see there's interoperability and integration. Obviously, bringing on a lot of best-in-class tools, need to integrate them. Telehealth and virtual care infrastructure, it's all post-COVID-19. And we know that in the early days of COVID, a lot of health systems had to stand up a telehealth platform virtually overnight. And now the need for having a robust infrastructure becomes important. Data and analytics, that's emerging, I think, still in early stages in healthcare. And infrastructure upgrades, cloud migration, emerging tech stacks. Any surprises here, Sara?
Nope. Infrastructure. That's the role of CIO. It makes perfect sense. I totally understand it. The one area where I noticed in the quotes that was actually pretty interesting is mobile app deployment. And that would be kind of because that's very consumer oriented. I mean, depends on what the mobile app they're referring to is, of course, but if it's but it looks like it's digital and patient focused. That's an interesting one. Is it focused on MyChart or Follow My Health or one of the other EMR focused mobile solutions, or is it much more focused on sort of an engagement solution? What we're doing is we've created on top of our existing infrastructure, a consumer engagement platform that is delivered via the mobile app, but it's really focused on orchestrating content, transactional information, communications, and all sorts of other things like that, and delivering that to the patient in a sort of personalized way. That's not what MyChart in our case, which is, where Epic Vaezy delivers. And so we've really looked again at the business case and the use cases for what we're trying to achieve with our mobile app, and then have started to develop on top of MyChart and using elements of MyChart that are really important to drive that. Yeah. So that's the one thing that kind of stood out, but everything else, it makes sense to me, and I think it really shows the interplay between the CIO and the Chief Digital Officer, CIO, being very infrastructure core technology focused.
Yeah, interesting. And this is the final question in our survey that we want to share with you, with the audience. The all-important question of budgets. What best describes how you're budgeting and funding digital initiatives? Now, we see that close to half the respondents said that they don't have a separate digital budget. It's all part of IT budgets. And I think it lines up well with the previous slide, which indicated that the CIO is also the leader for digital initiatives. And we do have, about 15%, 16% of the respondents who said they have a separately allocated budget for implementing enterprise digital initiatives. That I think is a very, very encouraging sign, because digital budgets have to be set aside separately in order to provide the kind of focus that it requires. And then, of course, you have in between, digital budgets being drawn from departmental budgets, and then some centralized budgets, and then some from IT, some from others. That's kind of the mix. Wherever the money is, we can get hold of it. And if there's a particular group or a function that needs an initiative to be launched, we'll figure out a way to pull money from different sources and get it done. So this is kind of the range of responses. But does it surprise you, Sara, that nearly half the respondents say that digital budgets are the same, it's kind of folded into the IT budgets? What is your experience with that kind of a model?
So the way that we do it is we have a separate budget allocated for digital, and I think it's essential to do it that way because it's a different discipline, it's a different set of priorities, and I think typically because technology in the health system sort of environment can typically be more infrastructure, core, back office kind of focused. If you don't reserve a specific budget for digital, It could just be like, yeah, we'll get to it later, kind of a thing. It's the core pieces of just change management and transformation and maturity, right? You need to have leadership, you need to have funding, you need to have governance and oversight. You need to have, and so I think this is just it's an important part of the transformational journey to ensuring that digital actually gets carved out and done separately, and is viewed as a strategic pillar and initiative within the organization, as opposed to like a service bureau or part of IS and like a ticketing system and things that like can be more historical kind of IT functions versus transformational kind of front end changes.
So I have a follow-up question on that for you, Sara. Very often a lot of IT initiatives and IT projects, if you will, they go through a very rigorous ROI analysis, and everything has to have a business case associated with it. With digital, a lot of times there isn't a clear ROI. And in fact, there may not be an ROI at all for a period of time, but you have to do what you have to do because it is strategically important for the enterprise. Is that also a reason why you think the budget needs to be separate, because you cannot put it through the same kind of process that you would if you were buying, let's say, hardware, for instance?
I think it's potentially problematic to say that digital doesn't have an ROI. And I think in the cases where maybe it doesn't, like there are certainly reasons why there wouldn't be an ROI. One is, I'll give you a very clear example for telehealth, for instance. If you just take a very substitutive model, which many had to do during the COVID period, and you say, we're going to swap out a physical visit for a virtual visit. And let's say you don't have payment parity and you don't have all these other kind of key enablers. Yes, there will not be an ROI, right? You'll get paid less for the same thing. And it may introduce inefficiencies in your clinician workflow, and it may introduce other kind of challenges. However, like if you rethink your operating model, it has, and not purely as substitutive, but like longitudinally in nature, you kind of deconstruct like a care pathway, for instance. And a really clear example is maternity care, which is like, has a very defined pathway. It has 14 visits. It has between when mom finds out she's pregnant and mom has baby, there's 14 visits, and you can deconstruct it into, this is what needs to be physical. This is what needs to be virtual or can be virtual, and this is what can be automated altogether, for instance, which there are some models out there looking at that. If you can do that, and you can then alter the provider compensation and the payment model and everything to match that, there's tremendous ROI. And so it's more whether you just view it as infrastructure, just sort of in isolation or as part of a broader care model. Another example that I'll give is actually we deployed digital, and we digitally enabled all of our low acuity or on-demand care. And it's for cases of like, sort of that I need care now. It's relatively low acuity, things that don't, that can be cared for in multiple modalities and multiple settings. It could be in a retail medicine clinic, or it could be in a virtual visit kind of situation. And even for those patients, right? Like typically the idea is, they come in, you charge them $49 for a virtual visit and they disappear. There is actually ROI associated with those patients even. And we've generated over $30 million in downstream revenue from capturing those patients in that care that otherwise either would have gone somewhere else, or they just wouldn't have gotten care and they would have suffered at home or whatever. And so I would actually challenge the notion that there isn't ROI altogether. Now, in some cases it is more difficult, and it does, like if you were looking at a behavioral health digital use case, it works better in a value-based environment. But I think there's a lot of kind of the message here is there's a lot of product and business model innovation that can generate ROI if you don't just think about it as infrastructure.
Yeah. I think that's very well said. Well, let's move on to the next segment in the presentation. At Demo Consulting, we have a digital maturity model that we've developed, and we've been using this for the last couple of years. It's also in my book that came out in August of last year, Healthcare Digital Transformation. Now, this four-stage maturity model really, follows very closely what we just discussed as part of the findings from the survey. So in our model one are entities that are looking at the EHR platform as their primary digital engagement platforms. Now that can be somewhat limiting. Model two are the entities that have chosen to go beyond the EHR and look at best-in-class tools, but very specifically for digital front doors, the online patient engagement, some amount of remote monitoring and patient communications. It's still, for the most part, in our view, managed as part of an IT function. So you look at the EHR platform for what it can do, but then you're looking beyond the EHR platform for best-in-class tools whenever that merits attention. Model three is where you have a dedicated leader who is driving digital initiatives, primarily with a focus on patient engagement and online enablement for access to care and things like that. Typically, the back-end IT infrastructure is not part of the digital leader's agenda in a Model 3 organization. Model 4 are the most mature organizations where there's a comprehensive digital transformation strategy that is led at the highest levels of the organization. Typically, there is a full-time chief digital officer that's reporting right up to the CEO of the organization. And from a technology platform standpoint, there's obviously the EHR platform, but there's also a couple of key strategic partnerships alongside the EHR that cover 60 to 70% of all the digital needs from an infrastructure as well as an enablement standpoint. And importantly, they have a robust governance model to leverage the startup ecosystem, because a lot of digital health innovation is coming out of the startup ecosystem. And so the most mature organizations have a governance model to leverage the startup ecosystem. So it's very, very comprehensive. And so when I started showing this maturity model to health system CIOs, pretty soon I started getting the question, okay, where do we stand within the maturity model? And that's when we developed this an online maturity model assessment tool. And the assessment tool has about 37 questions, and I can send more information if anyone is interested. There's also a white paper on this on our website that you can download. So essentially, we go through the maturity model in terms of different categories, digital front doors, care management, data and analytics, infrastructure, and org model and governance. And we convert the scores in the assessment responses. It's an online survey, basically. And based on the responses, we apply a scoring model that then we use for classifying or categorizing organizations based on their maturity level of vision and the maturity level of execution. So this looks a little bit like a Gartner Magic Quadrant chart for those who are familiar with that. And there's actually a numerical table with all the scores that I haven't shared in this presentation, but I'm happy to discuss that with anyone who is interested. So essentially what it says here, this is a sample of health system, and these are based on actual survey responses. So you can see provider one, for instance, is pretty strong on vision as well as on execution. Provider five is the same, pretty strong on vision as well as on execution. Now you can see cases where provider six, for instance, has a strong vision, but they're not executing as quickly as some of the others for whatever their internal reasons may be. Provider eight is very typical of what we see in many organizations. They implement a lot of digital initiatives because there is demand for it and there is a need and an urgency to act, but it's not part of an overarching organizational strategy. So what we've done is we've actually shared this back with all of the entities that have taken the assessment. And we've also shared this anonymized data as part of our white paper that we've published. But effectively, it's a way for health systems to look at where they stand in the marketplace and decide if they need to reprioritize any of their initiatives. And the next slide here, which is really a heat map, which is a section of the responses, and this is what may be interesting to those who are on the webinar today. We look at just the digital front door section of it. And as I mentioned, there are 37 different questions. This is just a handful of them. And these are the ones that pertain to digital front doors. And the heat map here shows that if you look at these high value digital engagement opportunities, online scheduling, chatbot, find a doc, symptom triage, and so on, and you look across all of the health systems in our sample, and these are, like I said, based on actual responses that we've received, you can see that provider 5, for instance, has implemented a number of these initiatives using standalone tools that are not part of the EHR. Provider 1 has implemented pretty much the same initiatives as provider 5, but they've done it more using native EHR capabilities. So, this is something that you can look at and go, okay, should I be looking more at standalone platforms? And what are my peers doing in the industry when it comes to some of these functionalities? So find a doc, for instance, if you look across all of the health systems, most health systems have implemented a standalone tool. They're not using a native EHR capability. Whereas for online check-in, pretty much using the native EHR capability. And for video visits, it's a mixture, right? So there's EHR, there is standalone features, and so on, right? So we've used this as a way to highlight how, even if you're implementing a digital roadmap, there could be significant qualitative differences between your health system and another health system. And this usually sparks a conversation about what the health system could be doing, either to reprioritize or to maybe look at new tools wherever they haven't implemented one, and at the very least get a benchmark of where they stand relative to their peers. And so Sara, you're familiar with this. We've discussed this model and the chart and the heat map and everything. What are your comments and thoughts on how health systems may look at something like this if they're doing an assessment of the kind that I just talked about?
I think this is a really interesting, like you'll notice a lot of blue in certain blue or green even, but blue in particular. You'll notice a lot of blue in the more, again, more consumer oriented rows or the sets of features and functionality that that are important. I will say the one thing that these initiatives are really about feature functionality and capabilities. What's not here and what's really interesting, and I think gets reflected in some of the deeper questions that's in the maturity model, is the extent to which these things are integrated together in the context of an end-to-end experience. And certain things start to get to that. Like for instance, slot management. Slot management is essentially getting to this concept of like, how are you surfacing up supply? And then presumably on the other end of things, matching that to demand, and is more of like an operating model kinds of question. But I think all of these, getting to like the previous comments too, really gets back to, okay, you can have all of this stuff, but how do you make it work within the context of your health system, your unique market needs, your unique market conditions around payment, and how you manage your providers and all that other stuff. So I think this is really interesting, and there are a couple really great questions in the Q&A and the chat. One is around like data integration. I think that is a really important piece of all of this, which is that there, like that continuity of the data, whether it be patient oriented or transactionally oriented data, I think is really important. I mean, slot management again gets to that. Like it's the data around your supply that's really essential, that you don't necessarily get if you have these standalone tools without integration. Yep. So that's something that we've spent quite a bit of time on getting right. And then it is also interesting, like second opinion, there's a lot of red there. And I know in our organization, like we're still red. And it's one of those things that it just signifies that either the market's not quite ready or there isn't like a clear ROI to your previous question, Paddy, about ROI, a clear ROI or a clear model to make that work, and not, for instance, have a perception that you're taking away from the business of the specialists that you have and things like that. So it all kind of comes back to features, functionality, capability, great. How are you going to integrate it into your system? I think is the integrated technology wise as well as business model and operating model wise.
Yeah, yeah. And of course, the yellows there are interesting to me as well, because that implies that there's a lot of standalone tools out there that are not integrated into your core EHR platform. And it raises a question of, is there a pathway to integration? Are they going to remain standalone platforms? How do they fit into the overall context of a seamless experience for a consumer? And so in our scoring model, at least, we tend to score the blues higher than the yellows for that reason. Any tool that is an out-of-the-box FHIR HL7 connector and can plug and play with the EHR system, like the slot management example that you just talked about, right? So we certainly attach a lot more importance to that.
And it's actually really interesting. I was surprised that there wasn't more yellow, in particular, like around video visits, for instance. Video visits, there's so many on-demand video providers like American Well and Teladoc, and they don't have deep integration into the existing systems. So I was surprised about that. So chatbot, for instance, not surprising, but that one in particular really does. I think it's paradoxical almost.
Well, this is meant to be, an initial. Well, the reason we do this assessment is to surface up the questions, right? And the next level of conversation really gets us into a discussion around what does it mean for your organization, to your point, Sara, right? So moving on, we're going to go into another polling question, the second and the last one. I'm going to read this out while the question comes up. Yes. Where do you go for reliable information on technology partner choices? Select all that apply. You can select all of them. So fellow CIOs and executives in other health systems, colleagues within my own organization, vendor rankings by Gartner, KLAS, and others, and prior vendor relationships or vendor marketing collateral, demos, etc. So we'll give it a minute for the responses.
Looks like we're getting some now. We'll just maybe give it 15 more seconds here.
Sure.
Okay, I think we'll go ahead and close it here. We've got 20 responses, which is great. So let me end the poll. And then I'm going to share results. Can you guys see those?
Yep, we see it.
Great.
Okay. Fellow CIOs, 90%. Fellow CIOs and executives in other health systems. And those in the technology solution provider community probably already know this intuitively to be true. Colleagues within my own organization, vendor rankings by Gartner, KLAS, and other. That's the number 2 source on this list, and prior relationships. So Sara, how does this line up against what you see at Providence?
I think it's great. I'm glad that folks are relying on each other, and we spend quite a bit of time at Providence actually meeting with other health systems. We've met with, I think we're up to like 175 health systems that we've met with over the last few years, doing pretty extensive on-site visits and overview of what we're up to, learning what others are up to. So I think that's great. The other thing I would offer folks is like, there's a lot out there in other industries, of course, that wasn't a question here, but there's a lot out there just in terms of, this is kind of framed as technology partners, but there's just how you think about
Consumerism, yeah.
Yeah, like there's a lot of takeaways from other industries outside of healthcare that is really valuable as well. That would be the only other thing I would add to this. The other thing that we do, we really try to avoid talking about vendors. And more focus on the problem we're trying to solve, and then take a very kind of rigorous approach to how we go about solving that problem. And we, you know, like from a vendor perspective, you kind of know you've succeeded when they talk about it, like the XYZ vendor project, because they've replaced the discussion, like the system will have replaced the discussion about the problem they're trying to solve or the opportunity with you as a solution. And we try to avoid that as long as we can. So, vendor rankings, they're somewhat useful and they answer some questions, but we do want to test things in our own environment against the problem and the requirements that we have.
Yep. Well, my big takeaway here is that the power of the referral network within the healthcare community is
absolutely.
really, really strong. And so, technology vendors ought to take note of that. All right, let's close this one out, and we're going to wrap this up in the next minute or two and open it up for Q&A. So for those who are, had a look at the maturity assessment and want to really take that and go to the next stage in terms of what they could do to leverage their benchmarking data against other health systems, we have a whole set of consulting and advisory offerings around that. We help you validate your assessment. We come in and do structured interviews and focus groups. We help you identify your roadmap priorities and help you with the business cases, and identify technology partners using our digital health intelligence database, which is something that we have developed internally. It's kind of a one-of-a-kind a platform. And Sara, you've seen this. We've got comprehensive information on the digital health initiatives of about 50 leading health systems, and we feature profiles of about 300 technology vendors who are serving these health systems with digital initiatives. And the data is classified by different technology and application categories and over 120 use cases. So I'm not going to go into a demo of the platform, but those of you who are attending the CHIME Spring Forum in April, I will be doing 2 live demos of the platform, and we'll also have some other collateral and data sheets and things like that related to the platform. But in the meantime, if anyone's out there is interested, I'm happy to respond back and give you an overview of the platform. We also have a categorization matrix for different kinds of technology partners. This is going to be in the slides. In the interest of time, I'm not going to go through this in detail today, but you will get this in the slide deck. And if you have questions, feel free to reach out to me. I do want to leave some time for the Q&A. So with that, that is going to be my last slide. Thank you very much for listening. And we'll open it up for Q&A.
That sounds good. Thanks so much, Paddy and Sara. I think the discussion between the two of you and looking over those survey results was really interesting. I also know too, it's nice to take a survey and then get to see some survey results. So I'm sure there were a few people out there who said, oh, I did that one. So that's great. Let's see. First question we have here is, hello, Sara and Paddy. In Germany, we don't get reimbursement for most of digital services. What is your experience with payers/insurers about reimbursement? Thank you.
That's a Sara question for me.
Yeah, it's a really interesting question and something that we're increasingly working on. I'll give you a couple examples. So, with some of our access platforms, they're not delivering the service themselves. They're enabling it. They're like they're a technology enabler. So you're not getting paid by an insurance company for like the enablement of an online booking, for instance. In other cases, they're actually, the system, the technology itself is more focused on the service delivery, or can enable or can do the service delivery in and of itself. One example of that, and we haven't really talked about that here at all, is around behavioral health. So we are working with a company that delivers a form of digitized therapy. And that digitized therapy, the health system has entirely paid for it, that platform. But the therapy itself, like the delivery of that service, is being done by the technology. And now we're partnering with payers to essentially for them to determine the efficacy of that digital solution that does the delivery unto itself, and then determining whether they want to pay for it. So I think, if we think about it from a maturity standpoint, how health systems and payers partner together around payment for digital is evolving. There are some areas where it's relatively mature. Like diabetes prevention is one area where it's relatively mature. There are companies out there like Omada and Livongo that get reimbursed by the federal government or other payers for diabetes prevention services. And those are digital solutions. And in some cases, there's no reimbursement and no kind of path toward it. And then there's a whole bunch of stuff in between. So I think it's a highly variable landscape, and something that's going to evolve a lot going forward, especially as I think value-based care in the United States gets a little bit more, picks up a little bit of speed, and we move increasingly toward kind of funding solutions that reduce the total cost of care. So I know I'm maybe not answering your question directly, but hopefully that's helpful.
Thanks. That's great. Another question we have here. Have you found that integration at the data repository / analytic level generally more achievable and just as valuable than at the EHR level?
I think you addressed this very briefly, Sara, but do you want to take that one again?
I don't know if I can answer it very clearly. I think, I think that's actually probably a question more for our, like, from a CIO perspective,
Yeah.
from my perspective. So
I can share a little bit of perspective on this based on the work that we're doing. Again, the data integration is probably one of the most challenging aspects of a healthcare environment, especially in the provider context. So from what we've seen here, there are several health systems that are now moving towards creating these data lakes, data repositories, single source of truth, those kinds of initiatives. But it's a very difficult task to get it all in one place and use it as a single source of truth. So we're seeing the data infrastructure and the data environments being very purpose-built, either for CRM or for population health management or very specific functionalities like that, because there's also a cost involved. And what some of the other larger organizations in other sectors have done, which is create this, this single source of truth, that is not happened here. Again, there are also issues related to data standardization, data normalization, and then the emerging data sources that you have to somehow standardize and normalize to bring them into the environment, which is why I think several tech firms and several data collaborations are also now launching just to try and address those questions. So it's still early days, work in progress, but there is success in pockets. That would be my observation.
Okay, that's great. Thanks. Let's see. I do want to say there was a question that was answered remotely, but I'd like to just lift it up because I don't know that everyone saw. There was a question: are we missing the opportunity to transform the physician experience and engagement? Patient loyalty to hospital, clinic facilities are influenced by their relationship with their physician. Sara, do you mind just lifting up your answer there so others can hear it?
Yeah, sure. Yeah, I think it's there are a lot of opportunities, and our focus on the patient or consumer facing front end should not be an indicator that that's not important. In our organization, we happen to have split it out at Providence, where our IS organization focuses on those types of technologies that are clinician and provider facing, and those things that are infrastructure and core and back office. And then the digital team, with its kind of consumer oriented expertise and experience, focuses on the patient and consumer front end. But it's not by any means an indicator of its importance or priority. It's just a division of roles and responsibilities, essentially.
Sure.
Yep. And I will add just one thing here. I think everyone recognizes that patient enablement, or providing patients with digital engagement opportunities, doesn't have to be at the expense of the provider's experience. So there is equal importance to the provider's experience. That's uniformly been my experience when working with the health systems that I work with. And individual use cases vary from health system to health system, but I think there's a recognition that one is not at the expense of the other.
And in fact, that the you can't create a truly awesome patient or consumer experience at the expense of the providers.
Right.
Like, it just won't work. And when we've done, when we've done either development work or partnering with external companies to achieve our patient-facing goals, that's always a key requirement, is like, what's the clinician workflow? How does it integrate into what they have to do now, and like the different panes of glass that they're looking at, and what kind of data can we deliver to them to make it much easier for them to do their job, right? The DexCare platform that I referenced earlier is a very clear example of that, but there are others as well.
Great, thanks. That's helpful. Another question that we had come in, what would you advise for smaller health systems when it comes to prioritizing digital initiatives?
Yeah, do you want to take that, or do you want me to take
Yeah,
that?
well, I think there is a set of priorities for the industry that are universal across all health systems, whether you're small or big. So a great example of that is telehealth. You have to have a telehealth capability in today's context. If you don't have it, you're behind. Now, similarly, there is a lot of patient-facing online digital engagement opportunities that have to be addressed on priority, regardless of how big or small a health system you are, because that has become table stakes in my view. So a lot of what we refer to as digital front doors, those are table stakes. The ability to do online self-scheduling, maybe the ability to find a doctor, the ability to make an online payment. Those are all, the ability to push a button and get an online video visit. Those are all becoming table stakes. So whether you're small or big, I mean, those table stakes items have to be identified and addressed ASAP. There's a number of things that you don't have to address right away. Second opinion. Do you need it today? Maybe not. Do you need a big central data warehouse and repository, which is a single source of truth? Maybe not, right? So there are certain things that you can possibly do without, but from a digital engagement standpoint, there are absolute must-haves that are in the digital front door roadmap that I would strongly recommend that you identify what those are for your market and go about implementing them right away.
I agree wholeheartedly. And I think Paddy referenced the right ones. You have to get your provider data right. And it needs to be able to be discoverable, and patients need to be able to book, both new and existing patients. And then you need to get your on-demand sort of provider agnostic offering right as well, whether it's telehealth or otherwise. Those are like the two biggest things just right away. And then in terms of the mechanism, don't recreate the wheel, right? Like, there are a lot of health systems out there that can be leveraged, and their experience and the pain that they've gone through can be leveraged, so you don't have to feel it yourselves again. My boss always says you don't get extra points for originality, and we beg, borrow, and steal from other industries and from other health systems as much as we possibly can. There's just a tremendous amount of knowledge and expertise out there that can be leveraged. And it sounds like folks are kind of already there, right? Like, you are all already referencing your referral network for these things. So continue to do that and work with the great companies and the partners that are out there to achieve it. You don't have to build everything yourselves. Those solutions exist.
Quite frankly, that's a lot of the advisory work we do is around that, finding the partners, identifying the right opportunities for you. Again, yeah, so happy to have a deeper conversation on that with whoever asked that question.
Sure. Okay, that's great. Thanks. I think I have addressed all the questions, which is great, and a lot of good chat discussion too. So this was really an incredible presentation. I want to thank our CHIME members for attending. As always, appreciate the time out of your day, and I want to thank Paddy and Sara for the great dialogue and discussion. So Paddy and Sara, any closing thoughts from you guys?
No, I just want to thank Sara for coming on and for sharing her insights from Providence.
Yeah.
It was good to have you back. Yeah.
Yeah, it was fun. Thank you for having me.
Thank you,
Great.
everyone.
Thanks so
Thank
much,
you,
everybody.
Harika, and thank you, CHIME,
Take care.
for putting this together.
Of
Bye now.
course. Have a good day.